Hi, my name is Allison Jones. I'm a senior athletic training student at Florida Gulf Coast University, and today I'm going to be performing a cranial nerve assessment test. First, I'm going to start with the olfactory, so cranial nerve number 1, and this is going to test my patient's smell. So I'm going to have you close your eyes for me, and I'm going to wave something underneath your nose and let me know if you can smell it.
Expo marker.
Great. So she can smell expo marker so that her cranial nerve number 1 is intact. Next is going to be cranial nerve number 2, the optic nerve, and this is going to test her visual field. So I'm going to use a Snellen chart for this. I'm going to have you stand over here and read the last row that you can read, and left to right, cover your left eye for me. T, P, G, E, Z, F. And then if you could cover your other eye and read it back from left to right.
F, E, G, P, T.
Great. I'm going to have you stand back over here. And also, if you could face this way, I'm going to be sensory, so let me know if you just hold your hand out like this, when you can last see your thumb without moving your head. Check your peripheral vision. Here. Okay? Do the other side. Here. Awesome. So that's normal, and I would compare that with my own visual field. Number 3 is ocular motor. So this is going to test my patient's motor skills of the eye. So I'm going to check her pupils to see equal dilation and constriction with the reaction to light. So if you can take off your glasses for me. Just look straight at my ear. Great. So with that, I'm just checking to make sure if I shine a light into her left eye, her right light also constricts as well. Next, for number 4, I have the trochlear nerve, and this is also going to check for the eye. This is the motor sensation, so this is going to have to do with how her eye moves. When I do this test, I'm going to actually lump together your trochlear and abducens, cranial nerve number 6. If I can just have you follow my pen line. So with that, I went up and down to cover the trochlear for cranial number 4, and abducens is cranial number 6, my bad, with the lateral eye movement. Back to cranial nerve number 5, I have the trigeminal nerve. This is going to test my patient's sensation. So I'm going to have you close your eyes, and I'm going to just use 2 different tools, a sharp and a soft object. I want to make sure that my patient can feel both of these sensations and distinguish between the 2. So I'm going to just touch something across your face and let me know if it's sharp or soft and if you can feel it.
Yeah.
What kind of feeling?
It's soft. Sorry.
I'm going to try the other side. So you feel that?
Yeah.
Okay. And now I'm going to do other one. Feel that? And can you feel it? Perfect. So she could feel both sharp and soft sensations. I'm also going to have you bite down. And I'm going to feel it. Masseter, do it again. I'm just feeling for that muscle contraction within her masseter for the motor sensation of the trigeminal nerve for number 5. On to number 7, I have the facial nerve. I'm going to ask you to smile and show your teeth for me. And can you give me a frown? And now wrinkle your forehead. Perfect. Next, we go into cranial nerve number 8, which is the vestibular ocular. So this, I'm going to have you just close your eyes for me and let me know if you can feel here. Good. Great. So hearing's good, and now I'm also going to test the vestibular part of this. So if you can stand up, I'm going to have you hands on your hips, close your eyes, and just stand there. Okay, you're good. I would probably let her go for about 15 seconds just to make sure she's not swaying. Next, I have cranial nerve number 9, which is your glossopharyngeal nerve. So this is both a motory and sensory nerve. So I'm going to just ask you if you can swallow your saliva for me. And making sure. Another test I could do is the third of her tongue. I could also test for taste sensations by dropping different taste solutions on there. It's like sugar, sweet, or sour. Number 10 is the vagus nerve. This is also a motor and sensory nerve. So I'm gonna have you open your mouth like this with your tongue out and go ah. Okay, and I'm checking this ear usually to make sure there's no deviation to one side because that could be indicative of nerve pathology. For number 11, I have the accessory nerve. This is motor function. So this innervates her SCM. So I'm gonna have you shrug your shoulders up for me. Great. And finally, we have cranial nerve number 12, which is also motor, and this is your hypoglossal nerve. I'm gonna have you stick your tongue out and move it from side to side. Great, so she's moving the tongue. So that's a cranial nerve assessment of 1 through 12, and thanks for watching.